for you all. So just a note at the end of this particular presentation, both the content that is presented here, as well as the audio of the webinar will be made available to those of you here in attendance. So we want to thank you for joining our webinar on why healthcare is so attractive to cyber criminals and what can be done about that. This is intended for those of you who are in healthcare, whether you're in security, compliance. It's something that impacts everybody. My name is Tom Leahy. I am the SVP of Sales and Business Development with SureShield, and I have joining me our CEO, Sanjay Kumar. He and I have actually worked together for almost 25 years. We both have been extensively involved in healthcare in particular, and in healthcare compliance, risk, and security. So, and of course, have seen a huge evolution of things that have taken place to back in the days when we first actually launched one of the first web-based, web-enabled healthcare analytics tools, to seeing today the issues we had with HIPAA back then and the types of issues we have with now the digitization of healthcare data. So we really welcome all of you and thank you all for joining this session. We're going to cover a few topics. First of all, the need for cyber resiliency in healthcare. And of course, this does not just impact healthcare, but healthcare in particular is being targeted quite significantly. We will also talk a little bit about some guiding cybersecurity principles around security, compliance, and integrity. We'll explain a little bit more what that means or what you may be dealing with that, having to do with people, regulations, and then assets, and how to secure those assets, and what the 4 planks of cyber resiliency are. Not to scare, but just to talk a little bit about some things that have happened, regardless of what kind of provider you are, whether you are a independent physician clinic all the way up to a large integrated delivery system. What is taking place today and will continue to take place. And then we will talk to you just briefly about some tools that are provided from SureShield, how we are helping support cyber resiliency and compliance in healthcare. And for those who of you are interested of learning more about some of those tools, we'll go ahead and make those available to you in a follow-up if you would like to learn more about what we do. And of course, we'll take on any questions and answers. I'm just going to ask, that I noticed there's a little bit in the chat screen, and Chandi, one of our other moderators, looks like he's answered that question. Just a note, if you have questions, please use the Q&A area in the Zoom webinar, as opposed to the chat. Is probably the best way to get any questions you have answered quickly. So with that, let's go ahead and start the presentation. So first of all, really, why is healthcare so targeted? And it actually seems to be very disproportionately targeted. Of course, we have seen over the last 2 years, just almost every day you're hearing something about a breach or a hack or someone causing havoc for someone else. The most recent CISA, the Cybersecurity and Infrastructure Agency, just released even yesterday a very critical warning to all private and public companies about making sure that they're going back and checking their resiliency, as there's been some significant attacks in the Ukraine with all the tensions that are rising there in the Ukraine with Russia. There's been some significant attacks, and all those attacks that are happening are the same type of attacks that will be happening here. There is a silent cyber war that's going on right now, and it's becoming more and more prevalent with us here. But if you were to look at healthcare and the proportion of what the the people are in the workforce to the workforce that's out there, and then the proportion of breaches that are taking place in healthcare. Healthcare makes up almost, this says 34, it's almost 40% of all the breaches that are taking place right now. And that's, again, there's been others that we've heard about, pipelines and gas pipelines and production areas that have been hit, but healthcare is a very, very significant target. And why may that be? What is leading to those issues? Well, first of all, the black market value of a healthcare record is very significant. It's the most beneficial, most valued piece of data on the dark web. So, folks that are interested in stealing information and doing stuff with that information on the dark web, they get a lot more bang for their buck, and they can sell it for a lot more than they can even a credit card. And why, of course, is that? Just think of the amounts of data that are in a healthcare record. You have personal information, you have addresses, you have social security numbers, you have credit cards, you have information on their actual health information. There's a tremendous amount of fraud that takes place with people going in and using fraudulent healthcare IDs and getting services performed for them. So obviously, it's a very highly targeted piece of information from a value perspective. And why is that? Again, why would people be targeting? Well, think of what has transpired over the last 2 years. There's a lot of competing management priorities in healthcare right now. With this COVID pandemic has really directed a lot of resources away from what we might call sound infrastructure in healthcare. So with the pandemic, we all experienced this, so much was being directed towards healthcare, and actually critical healthcare, almost chaotic in that regard. That very, very little attention was being paid to shoring up infrastructure. And when that happens, the best opportunity for a criminal to attack is when your defenses are down significantly. And so, the double whammy was you have very valuable information, and you have very few resources that are properly protecting that. And that also goes to a security infrastructure that has always, for the most part, lagged behind most other industries. The level of I would say the numbers of very, very sophisticated healthcare IT professionals is more limited in that industry than it is in others. So, lack of having good resources and talent in this just leads to another area. And maybe Sanjay, you can comment on this last bullet around what has actually been transpiring in healthcare over the last year, what that's leading to.
Sure. Thank you, Tom. Yes, in terms of governance, as you all know, there were some changes that actually occurred to the HIPAA regulation. So regulations are constantly changing within the healthcare domain. There's now even more stringent requirements for healthcare institutions to safeguard data and its security downstream. So not just at the entity level, but down to the subcontractor level. And that imposes a process that institutions need to have to make sure that subcontractors are abiding by the same HIPAA requirements as their primary entity is. So that's a very, very important piece. And as Tom will explain later, the systems actually allow for that. Within healthcare, there's also a lack of what you might call standardization in terms of the way things are done, even within the same entity. Each and every department, or for a multi-site type entity, since these are mostly acquired through multiple acquisitions and the like, lack a consolidated, standardized process. So bringing some of all of that together in a much more disciplined fashion helps with both compliance and security.
Yeah, and I would almost say it just turned out to be a little bit of an impending storm, meaning that we were involved with a number of large IDNs ourselves a few years back. You look at the consolidation that's taken place in the industry, Advocates in Aurora Healthcare and Dignity Health and CHI, and all of these were, a part of it was with an intent during that time frame to create more standardization across. And as those consolidations began or are beginning, then you have a pandemic issue where it just threw things into chaos. And so again, leading to lots of different holes in infrastructure and process, which ultimately led to folks taking advantage of that from a stealing standpoint. And how significant is that? If you were to look today, I think they're reporting that there's been an average of 2, healthcare breaches reported almost every single day. And that's across a variety of different providers, from large IDNs to large healthcare clinics to your, of course, your healthcare providers, your insurance providers. It is a highly targeted market, and it's urgent. And if things are not put into place to actually help better protect this information, it will continue to get worse. So what are those, guiding principles for protecting information? And they really go to people, process, and I guess regulation and assets. The first is around what is your infrastructure? What's your security infrastructure? What type of systems do you have in place? What kind of computers? What kind of assets? And again, complexities that even come more into healthcare. Think of how digitization has changed things over the last 5 years. In a healthcare setting, you have digital records. You have more smart monitoring systems, with monitors that are monitoring patient care. You have video surveillance, you have telemedicine type things, all that are, if you would say, digitized, more complex on the web type information, and it's even more complex in healthcare. And given that, there's a lot more opportunities for bad things to happen, and there's a lot more assets that need to be locked down and secure. So it's incredibly important that you have good systems in place that can combat and look at emerging vulnerabilities and threats. On top of that, of course, in any industry like healthcare, it's a fairly highly regulated industry. You have your joint commissions, you have your accrediting bodies, and then of course you have your federal regulations as it relates to HIPAA. And I would say in one case where our government has been probably the most stringent when it comes to penalty is with healthcare providers, that if they're identifying you are not following proper compliance guidelines, or you have had a breach of information, they have been much more, the types of fines and the types of penalties that have come down on healthcare organizations has been even that much more stringent and significant and pointed out in the news. And therefore the needs to be following good compliance guidelines is even that much more critical. And then lastly, you have the people in your organization. Again, different types of oversights that are perhaps a little bit different than other industries, where you have regulations that require that you have good processes to make sure that the people and the vendors that you are operating with in your environment are sanctioned or okay to do so. Because most entities are collecting at least some form of federal payment, there are systems in place, government oversight systems in place that require you to make sure that you're not working with anybody on, think of it as the bad list. We're all familiar with the different types of lists out there that are banning providers or vendors from participating, and then what the impacts are of that if you were to do that. And on top of that, the importance of protecting data, looking at different ways to help with workflow processes are critical, because the shortages continue to get greater. And there's always been staff shortages in healthcare. We, of course, are even seeing it more over the last 2 years, where people are just overwhelmed and perhaps walking away because of the issues, the pandemic issues, which again leads to a more perfect storm, as well as a greater need for folks to look at how they can use tools to help them with those processes. So what are some of the pillars of of this whole process? It's really, again, related around security, compliance, and integrity. Ensuring that the data on the security side and the vulnerabilities and monitoring the dark web type things are in place, that you have your compliance mandates and that you have your requirements to make sure that the people that are in your environment are okay to do so. And how do we go about that process? Well, it starts kind of with the 4 planks of cyber resilience for healthcare organizations. There's what you might call the system design, setting up a system and a process for making sure you have good oversight of all of these different areas. And then there's the needs to deploy into that environment, to actually, once you've decided what that design is going to be, to carry out the deployment. And this is not a one-time static type process. It requires ongoing surveillance. And the underpinning of all of this is also making sure that you have compliance and good governance. As much as we'd like to say compliance is oftentimes a very significant issue that drives a lot of these processes, while the reality is you're better to be properly secure than to be properly compliant, but proper security will lead to proper compliance. And we can just talk a little bit about what those components mean. So under design, on certain areas of design as it relates to your, I would say, your IT computer type assets, it's making sure that all your organizations are using multi-factor authentication, establishing different layers in terms as to how people can access sensitive data or applications, keeping in mind a lot of people potentially have a lot of access to information. This is where a number of our HIPAA violations have taken place in the past. They're not necessarily, I would say, technology related, they're human related. People having information that they shouldn't have access to, and then utilizing that either intently or sometimes not intently for the wrong purposes. Obviously, establishing and putting in rules and policies as to who, how, and when people can access information. And then, you're definitely installing a process for updating and oversight of any of your operating systems, the applications that you have in place, and leveraging and looking at outside resources that can tell you where big problems exist. There is an organization called, I mentioned before, CISA, the Cybersecurity and Infrastructure Security Agency. It's an arm of the federal government, and they are constantly looking at what are the most critical threats that are out there and releasing information on what those are, how to fix them, and how soon those need to get fixed. And we'll see more and more of that over the course of the next years. But putting good systems in place and establishing designs to secure any issues and holes that you may have in your organization is critical. So putting a design around that in place. And then it gets to deploying that information. So making sure that if you're doing any development operations within, that you have, separate ways in which you can keep an eye on how all that is being created, how that gets pushed into your environment, and proper processes for doing, what I would call proper vulnerability analysis before those are brought out into the culture. And, again, then developing a culture of continuous improvement, meaning to operationalize this, doing periodic audits and checks, having ways in which you can get exception-based alerts. This becomes even more critical when you are short-staffed, that you have systems that can help you, alert you to problems you have, not necessarily everything that's going on. In an environment where we're resource strapped, we want to know, for instance, where we can direct our biggest bang for improvement. And we want to know where things are out of whack, not necessarily what is working. We want to be alerted if something starts to look like it's moving in a wrong direction for us. And so having tools that can help do that in a more automated fashion, in a more action-based fashion, is really critical. And of course, then having tools and software and pieces in place that can help us understand what threats and vulnerabilities we have, and more importantly, how to fix them and how to stratify them. And that goes with, again, the ongoing vigilance. This is not a one-time set it up process. There needs to be a regular, continuous monitoring process for looking at different areas that may impact your organization. And those cross a variety of different areas. Sanjay, I don't know if you want to comment on this a little bit.
Yeah, I want to bring up actually two examples, Tom. One is, traditionally how healthcare is operated with a number of activities. Let's take looking for sanctioned and exclusioned contracted healthcare providers that might be working within a healthcare institution. And you remember, the healthcare institution is going around after they provide their service and generating bills based upon the services that they provide. Traditionally, the way that sanction and exclusion checking has been done within healthcare institutions is doing it either when they enter into a contract or employ those kind of providers on board, or to do it just periodically, like once every 3 months or the like. But imagine if a healthcare provider on your staff or on contracted was on one of those exclusion or sanction list, on one of those Medicaid lists for the states. Well, you're in trouble, because for each and every bill that is submitted, there's a fine for $11,000 per submitted bill, right? There are institutions that have been charged, well-known institutions that have been charged fines north of $5 million for such type of issues that have occurred. The systems that we are talking about is putting really systems that can continue to do this function and report back based upon finding exceptions. So whenever a physician's data is updated, or whether the exclusion or sanction list is updated, the check automatically occurs on both sides. So those are the kind of systems I think you need to have: resilient, robust systems that can perform these checks and keep you updated and informed at all times.
Absolutely. And that also goes not just to the employees and to the providers, but it goes to the vendors as well.
Yes.
Meaning that you have vendors in your environment that need to be constantly evaluated and checked. And what we've seen today is Sanjay mentioned, the best practice and what has been recommended by the government oversight, the entity that's over this, I believe it's the OCR, that that at a minimum, you should be doing this once a month. Hardly anybody has the ability to do that if they don't have good tools or systems to do that. Because think of whether you're a relatively small provider or a large provider, the number of new people coming in and out of your environment, the new vendors that are coming in and out of your environment. And if those are not being constantly monitored, it's almost guaranteed you're going to have one that could be a bad actor in there. The same goes, on the technology side for things like utilizing tools to do dark web searches. A lot of times that you can get to tools that can tell you whether there's been breach data already in your organization. And by having that, sometimes that, sometimes you don't. But it allows you then to actually take the proper actions for fixing that. And then lastly, of course, making sure that you have a regular oversight within your security department about looking at what we call the vulnerabilities or the different types of attacks that are coming, and making sure you have good process in place for fixing those. And then lastly, part of this all leads down to compliance issues. That for you to be able to do this in a good fashion, it needs to be a continual readiness process. That the types of oversights or the areas that you have to look at, whether they be HIPAA, many of you deal with credit cards, you have PCI oversight. There's different types of security protocols like NIST, which is a cyber technical process for managing data, and a lot of healthcare systems are employing that. But utilizing those frameworks and constantly evaluating where you are in those, both from a compliance standpoint and then obviously from a security standpoint. And again, not necessarily related to what we do. We do have some tools that can help with this, but both Sanjay and I spent a lot of time working on the policy and procedure side of things in the past as well. So the importance of having your policies regularly updated, that you're following the compliance requirements for when they need to be reviewed, making sure they're current, and most importantly, making them easily accessible to the staff so that they are not accessing things that could be redundant or actually be wrong. So all of this leads to issues of how healthcare providers can at least work on improving that process. And I don't think we need to spend a lot of time on what the cost of poor security, compliance, and integrity performance is, because we see it almost every day. But there have been issues of course, on a horrible side of this, people having tragic events because of attacks where information that was needed to treat a patient perhaps created a problem. The amount of data that's been hacked, we've seen even with what we might consider our largest, most sophisticated providers most recently, like Intermountain Health and others, have been hit. So nobody is exempt from this. And that gets again to, why should you be worried about this and why should you be looking at putting good systems in place, is because it doesn't matter who you are. The impact is happening across small and large organizations. And actually, a lot of these attacks now are being directed at those that typically haven't had a lot of good resources in place to help them do that. But just below, if you look at a few examples, Intermountain, the Florida Blues, Scripps Health, Temple, I mean, it goes on. And if many of us remember, a few years ago, there was a huge ransomware attack with Northwell Health as well. So the impact, obviously can be impactful in terms of patient care, in terms of your organization's reputation, and not even just your reputation, but the costs that can be associated with that, whether it's paying fines, whether it's paying ransoms, or whether it's just the economic impact of bad publicity and press. And did you want to add anything to that, Sanjay?
No.
Okay. So just in terms of how SureShield may or can help you, like we've mentioned, we've been involved in this field for a long period of time. We're particularly well versed with the number of issues that go on in healthcare and have done a lot to help organizations in all of these areas. And we break that, what we call that SCI, security, compliance, and integrity. We have offerings that help with that process and help with what we call that exception-based process. So on the security side, or under the auspices of Security Shield, we provide some tools that can help do vulnerability management and remediation. What does that mean? We have really simple to deploy tools that will go out and look at all of what we would call the assets, the technical assets in your environment. And we run what we call a utility that acts like, think of it as like a friendly hacker. It will go out and scan your whole environment, and then it will look for holes or vulnerabilities that may be exposed in that environment. And we do that both internally, which means within your network, and externally to externally facing, web, internet related applications. And what is then done is it actually very quickly can tell you where there's issues, but more importantly, not just where the issues are, what the severity and criticality of that particular issue may be. Because as we said earlier, this is an ongoing, there'll never be a day where you do not have some exposed risk. But the most important thing is identifying where that largest area of risk is, and not in just where it is, but how to fix it. And we provide that type of guidance, and we help prioritize so that, if you're someone that has to do this, that's involved in this, we can help you prioritize what's going to reduce your risk exposure the greatest by applying certain types of remediation practices, and what impact that will be. And not only what impact, but what time and perhaps expense may be associated with that. So it's a great tool to help take to leadership to help them understand where they should be directing their resources for the best impact. And today it would be these types of processes 5 years ago were not as highly publicized or not as highly up the food chain as they were in the executive suite. Today, if this is not one of the top priorities, it's certainly in the top 5 because of the critical impact that can happen by having these types of attacks. And on top of that, then we also have some tools that can monitor the dark web to see if you've actually had some breaches already and where they may be and how to fix those, as well as ways to actually even lock down more critical data within your environment. We provide compliance tools that can help automate your whole compliance processes. And these are things that you have to be doing minimally annually, as HIPAA audits and the like should be done, and security plans should be submitted on a regular basis, but we help automate the whole HIPAA compliance auditing process. And we actually also marry that with the security piece, because we can identify, for instance, in a security scan, whether there is an area of compliance that may be out of whack, right? That could be improper passwords or access rights that people have, which are oftentimes questions in HIPAA audits. So if we can run a scan and actually help you automate that process to some degree, and most importantly, then take action to close those gaps, and then see what impact that has had on your overall compliance. And then lastly, when we get to the people side of this, we have solutions under what we call the auspices of Integrity Shield that does real-time oversight of employees, vendors, and contractors. As Sanjay mentioned before, we talked about, the government recommends that these types of sanction checks and exclusion checks are done minimally monthly. Very difficult to do when you have lots of different people and vendors. And even that is not, in our mind, sufficient enough. Meaning you could have someone that you've checked 1 month and 2 days later goes on that list. And if you don't know that, you're in deep potential financial issues with that. So what our system does is it does real-time, 24-hour, 7 days a week checks on those databases. And it provides that exception to help you with your staff that is, obviously, as we talked about, probably short, and being able to very quickly identify where an exception may be that you need to take action on. If you know your providers on a daily basis are fine and they're not having issues, you don't want to focus your efforts. You want to know if you have somebody that may have all of a sudden showed up on that list and the actions you can take to prevent any further damage to your particular organization. So I hope that this has been somewhat helpful. As we know and will continue to see, healthcare is critical for us just in general. It's critical to our nation's health, no pun intended, and protecting it and having the right tools in place to protect this critical information is very key. And again, with the types, the different things that have been thrown down on healthcare, lack of people, new crises in the overall, COVID situation has made this even more critical and more important to focus on. And, we hope that we can help in some way for those of you that are taking care of our people out there. So I don't know if you have anything else to add, Sanjay, but if not, we can go ahead and open it up to questions.
Yeah, one thing that I will add, Tom, is a key advantage of some of the things that we provide across the solution suite that I need to emphasize is the crosswalking or the harmonization of controls across multiple frameworks. So for example, if you are assessing yourself for compliance for HIPAA, then those are crosswalked with the NIST controls as well. So you will automatically be able to see how you have done on the NIST side of things as well, or some of the other frameworks that might be applicable. So that's, I think that was what I wanted to add, Tom.
Sure. And there's a question here from a gentleman. It's more process on, I think, on the telehealth side of things. And Mohan, I'm not sure if I can answer this question for you, but basically he's asking, Medicare pays doctors now. Actually, telemedicine has exploded a little bit. They'll pay them for talking to patients. And if they were an India doctor, you see the question, do you have any?
Yes, so I can actually answer that, or really based upon the way that the compliance frameworks are structured. First of all, any patient care data is to be within the geographies of the, within the country, right? It cannot leave the bounds of the country. So if, let's say, I want to answer this as technically as I can, right? If the data that let's say, for example, so first of all, I don't know what kind of arrangement this might be in terms of the service being provided by the Indian doctor on the other end, but just understand that doctors need proper licensing and proper authority in order to be able to provide guidance on care or to be able to prescribe. So first of all, whether this is legal, illegal, there's a whole bunch of other ramifications for that. But aside from that, if the data being accessed is on a system that is within the confines of the US national borders, then there is no HIPAA level egress of that data, right? So there might be no violation from a HIPAA perspective. But if the data is being used or being utilized outside of the bounds of the country without permission and without the proper contractual agreements in place, then there's most likely a violation. And yes, Mohan, I mean, if you want, you can connect with me. My email is,
You know what, Sanjay, if Mohan, if you'll have a follow-up email, just message back, and then I will go ahead and provide you with both contact number and an email for Dr. Kumar.
Okay.
Any other questions with the folks that we have here in the audience? I'm not seeing any. So just a note.
Maybe you can talk about some costing, Tom.
Yeah. As far as, I mean, the products are cost, obviously have some different costs, but basically on the integrity side, we look at the number of vendors or employees or that will need to be monitored on a regular basis. And then there's just a very nominal annual licensing cost for those. So it's, it's a 24/7 and it's an annual license. So we don't necessarily change that unless the numbers change significantly. For the security tools, it's really, again, looking at, there is some variation depending upon how many, what we call IT assets need to be monitored, but it's basically a monthly cost for the months in which scans are run. And when I say that, there are some organizations that just don't have the bandwidth to do this, let's just say on a daily or monthly basis. So in any given month, you can run as many of those scans as you want and do your remediations. And then the charges are only for that particular month. And then our compliance solutions are really just a one-time, well, it was a annual subscription. So depending upon the number of frameworks, we package up a number of, whether you have HIPAA, PCI, we have over 32 different what we call frameworks or compliance frameworks that can be leveraged. And there's an annual fee for utilizing those as well. And of course, if you're using multiple products, there's discounts that come with that as well. So you will be receiving a follow-up email, both with the presentation and the webinar audio. And certainly any of you that have any interest in a product or being contacted after this, please indicate so when you receive that email, and we'll be sure to get back in touch with you. We are more than happy to give you, an even deeper dive into any of the solutions that you may be interested in. So with that, unless there are any other questions, and I don't see any right now, we will go ahead and conclude the session. Is there anything you want to add, Sanjay, or conclude with before we finish?
No. I think all I want to basically say is I think the day and age is changing fast to basically literally having systems in place that can do the work on a more ongoing, continuous basis and be able to alert and inform based upon the underlying data.
Great. And all the best to you who have joined. Hopefully we'll have an opportunity to communicate with you again, but hope you have found the content to be beneficial. And to those, the gentleman who'd asked for contact for Dr. Kumar, I will make sure to reach out to you and get you that information. Thank you very much, and best for the rest of your week here. Take care.
Thank you.
Bye.